Good morning and welcome everyone to today's webinar, our first for 2025. We're looking forward to showcasing Blue Mirror and talking you through how we can support your organisation to meet safety and quality standards in both aged care and hospitals. Before we get started, I've just got a little bit of housekeeping. Today's session will run for approximately half an hour and then we'll have a Q&A session at the end. All attendees will be muted for the session, but if you have any trouble hearing us, we suggest that you exit and rejoin the session. We will be monitoring the live chat, so if you have any questions at all throughout the session, pop them in there and we'll either respond straight away or at the end. And finally, a copy of this webinar will be made available in the coming days on our website. Despite our best efforts to always keep things short, we have quite a full agenda today. So we'll start with an overview of Blue Mirror training and how it works, addressing common questions. Then Chloe will talk to the strengthened aged care quality standards and will present a case study of the Blue Mirror use within a large aged care facility in South Australia. Moving forward, I'll talk to the National Safety and Quality Health Service Standards and present to you the two evaluations that have been run by Maria Jaraja and Joel Collins from the Central Adelaide Local Health Network. Finally, we will give you a sneak peek of our Aseptic Technique Training module, which is due to be released later this year. So to kick off the introductions, I'd like to welcome Chloe Hunt to the webinar. With over 15 years of experience as a practice manager and quality manager through primary, secondary and urgent care settings, Chloe brings a strong passion for healthcare quality improvement. Her focus has always been on enhancing patient outcomes and promoting staff wellbeing. With her wealth of knowledge, Chloe's been a fantastic addition to the Blue Mirror team as our National Sales and Account Manager across Australia. And finally, for those who don't know me yet, my name's Holly Hodson and I'll be facilitating today's session. I'm a registered nurse and Global Head of Sales for Blue Mirror. And my goal is relatively straightforward. I want to bring solutions to healthcare that ease the pressure on healthcare workers and in particular nurses. Obviously, I'm a little bit biased with that. So we started off a couple of years ago with a very clear mission, improving life through AI. And this started with practical PPE donning and doffing training, automated data capturing with some reporting functionality, and progressed to include hand hygiene training. Working with technology demands a certain level of agility, and we embrace this with complete enthusiasm. Alongside providing our customers with our PPE and hand hygiene solutions, we constantly looked to the health sector to know what else is missing and what do we need next. So Blue Mirror in 2025 looks a little bit like this, bringing not only practical PPE and hand hygiene training, but competency assessments, interactive admin consoles that schedule and manage your training, incorporating bite-sized theory and clinical-based scenarios. We've introduced role-based training, which makes our solution work for everyone within your healthcare organisation. And this is not the end, it's always changing. We're dedicated to improving life through AI, and that means we will continuously work with the health sector to produce market-leading training solutions that free up precious clinical resources. So we will now take a little pause to show you a quick 2-minute video which walks you through Blue Mirror in action. This video is a demo of a donning protocol, and just to reiterate, all of the features that you're about to see are tailored to align with your organisation's protocols and procedures. So we'll get that started.
Please show your hand to choose a protocol. Welcome. Our hands have the power to heal or harm. The outcome depends on how we choose to use them.
A patient is in contact precautions, requiring you to wear gloves and a gown when interacting with the patient. On your morning rounds, you notice the patient is coughing, and they report to you they've been feeling unwell overnight with a fever and vomiting. What PPE precautions should you take with the patient? Correct.
Perform hand hygiene. Done. Put on gown. Ensure neck and sides are secured. The neck of your gown seems loose. Turn around and please wait, I will check the back of your gown. Checking back of gown. Gown open at back. Please face the screen again and review the back of your gown. Turn around and please wait, I will check the back of your gown. Checking back of gown. Please face the screen again and review the back of your gown. Done. Put on your mask. Mold the nose piece. Base of mask under chin. Done. Put on gloves. Cover the cuff. Show your hands upright when done. Checking wrists. Your left wrist doesn't seem covered. Your right wrist doesn't seem covered. Done. You're all set. Thank you.
All right, so let's take a closer look at those features and address the most common questions we get from people. So firstly, Blue Mirror utilises computer vision AI. It sees and responds to your actions. We do not use any facial recognition at all, nor do we store any images or videos of users. We include customizable audio and visual prompts, so what you see on the screen can be tailored to your organisation. Everything from the command itself to the image that's displayed when it's talking. Our protocols are designed by you for your organisation. Our implementation is a shared project where we walk you through the setup and customizations and continue to work with you while we introduce this tool to your team. Blue Mirror can be used on a range of compatible devices, including iPads, Surface Pros, desktop computers with a camera, and most late model laptops. We can provide you with a complete list of compatible devices if you request it. And finally, as you see here in the image, with our StereoMat PPE training station, you have a completely mobile hand hygiene and PPE training solution on wheels, which can be used for practical training, competency assessments, and even stationed in specific units to support your organisation during an outbreak. With our scenario-based questions, you can help to bridge the theory-practice gap and assess your team members' knowledge on a range of topics. You can write your own scenarios and have multiple to suit different departments within your organisation. For the end user, they have a choice of answers and get immediate feedback so they can instantly assess their knowledge. With each training, users get interactive feedback and corrective actions where errors are detected. This is really important in the learning journey because it helps to enforce the correct technique by addressing errors immediately. And if you think about the way we train people one-on-one, if you're directing me step by step, that's exactly what you'll be doing. You give me constant feedback, and if I do something incorrectly, you tell me, and then you tell me what I need to do to correct it. So we're simulating that one-on-one training experience. And here you can see a couple of examples of detecting errors with my gown. Then the next one is that my hand hygiene was too short. And then in the last image there, my wrist is still exposed with my glove on. Arguably, the quiet underdog in our product is the admin console, which provides a range of tools and features that are specifically designed to reduce the administrative overheads in planning, scheduling, and reporting on training and competency assessments. The interactive dashboard provides a snapshot of how Blue Mirror is working within your organisation, and here you get key data points and information that enables you to compare different departments, as well as capture feedback within staff surveys. In the middle image there, you can see the PPE protocol design tool. So this is where all the magic happens. Design and customize your protocols so they're tailored to meet all your requirements and train your staff your way. And in the last image there, you can see that we recognize the efforts of your team members with a full certification management process. And you can even integrate this with your learning management system. Blue Mirror is built to integrate, so we have a number of options of how we can do this, depending on the size and it doesn't matter how small you are or whether you're a large enterprise group of facilities. We are very proud to say that we're now in hospitals and healthcare facilities in the UK, New Zealand and Australia, Singapore and the US. This is a true testament to the flexibility of our training. The variation within states in Australia, let alone different countries and continents, is definitely vast. And we're really happy to say that our solution works for you no matter what your protocols and procedures are. I'm now going to give you a little break from my voice and hand over to Chloe to introduce the changes that have been made in aged care. Chloe, over to you.
Thanks, Holly. As some of you may know, from the 1st of July, the strengthened aged care quality standards come into effect. These recent changes are designed to be simplified, comprehensive and measurable, with putting the patient at the centre of their care. It has a strengthened focus areas, and each standard has intent and expectation statement with outcomes and actions. We have had a number of inquiries from organisations asking how Bloomer can support them to meet these new standards, as there are significant changes within the training and IPC space. Last year, we attended the International Forum on Quality and Safety in Healthcare in Brisbane and met a number of quality managers from aged care who resonated the same concerns. What I like about this image is it shows how the IPC risk management in groups, making management and assessment easier to understand. Aged care facilities need to manage risk in relation to the older person, their carers or families, the aged care workforce, the delivery of care, care equipment, and the care environment. All of this is the basis for good health outcomes for older people. However, this does present some challenges when we look at training and delivery and reducing infections. Things such as high turnover of staff, large number of overseas workforce, remote locations, high-risk clients, and finally, uniquely aged care has a lot of non-clinical staff that interact with your patients compared to clinical staff. With all of this considered, training can absolutely be a challenge. So looking at it more closely, standard for the environment, this standard focuses on how you can support not only your staff, but also older people and others, such as visitors who need to use PPE and how to use PPE correctly. For organisations, a training program that is diverse in how it can be used, particularly supporting who needs to use it, is key. Bloomer can absolutely support you with this. Our PPE and hand hygiene training can be used by and tailored to visitors as well as clinical and non-clinical staff. This training can be offered in a range of languages to increase comprehension and be swiftly converted to a PPE checker during times of an outbreak. And Holly will talk you through that a bit more shortly. Standard 5, clinical care. Standard 5 has an emphasis on minimising and managing infections when providing clinical care, including during clean procedures and aseptic techniques. Again, this can be challenging when you have a high turnover of staff, workforce of staff who do not speak English as a first language, and those that have not practically covered off aseptic techniques in a really long time. In a few minutes, Holly will showcase our aseptic technique training, which will be released to the market in the second quarter of this year. Back to you, Holly.
Thank you. Okay, so we understand that protocols need to be customisable to align with your organisation, but how do you address training requirements within different roles within your organisation? So with role-based protocols, you can set specific protocols to train groups the way they need to be trained. For non-clinical staff, you can have protocols that cover off training requirements with more layman terminology and less clinical language. And for clinical staff, you can have a robust PPE and hand hygiene training program, which highlights and assesses the principles of infection prevention control, as well as the techniques required to don, doff, and complete hand hygiene safely. The strengthened standards focuses on supporting visitors in addition to staff, and this has the risk of being very time intensive for organisations. How do you expect to train visitors effectively without drastically increasing your resources? With Blue Mirror, you can now have a specific protocol which is training visitors to your facility on how to correctly put on a mask and wash their hands or don PPE. So you can see on the screen here, this is showing an example of how you would instruct someone, a visitor to your facility, to put on a mask. They can select the language that they speak. It's simplified guidance. There's nothing checking about it other than that it's correct right at the end. There's no clinical language whatsoever. And again, you would customize this completely to be really suitable to your organization and the types of visitors you have. Anyone that has worked within aged care knows that you regularly have to manage outbreaks, and with high-risk clients to keep safe as well as staff, it's really, really important. So with Blue Mirror, particularly in combination with the SteriMat PPE training station, you have a training tool that can easily flip and be used as a PPE checker during times of an outbreak. So this means that staff, both clinical and non-clinical, have an additional layer of safety that will prompt them if there's any errors in their donning prior to entering an isolation space, and then afterwards guides them safely through the doffing process. So now I'm just going to talk briefly through one of our customers that we have in South Australia. They've got 4 locations and about 600 staff. We implemented PPE and hand hygiene training and competency assessments on dedicated iPads. So they had 1 iPad in each facility. They've been using Blue Mirror for a full year now, and this is what they had to say about their experience. So we asked the Manager for Governance Strategy and Clinical Development, what led you to reach out to Blue Mirror initially? And she responded that they wanted a solution that would provide staff education and simplify their record keeping. They wanted the ability to run reports in real time and demonstrate compliance and staff competence. They wanted an innovative solution that addressed those needs. And we stood out for them due to our advanced AI capabilities, but also the ease of integration and access to support from us. We then asked, what was their approach to transition their staff to new technology, which can absolutely be a challenge. So their response was the initial planning, so making sure that there was dedicated time for this rollout and customization. Training and support, ensuring that Blue Mirror was there to support them with their training needs and issues as they popped up. Having a phased rollout, so being really strategic in which sites they chose to go live with first and how they engaged their staff. And the feedback loops, and this is really important. So having a structured feedback loop from the staff up to their internal management and then again back to us, and that's been invaluable throughout this process for us as well as them. And then finally, when asked what is the biggest improvement, advantage, or benefit they've noticed since adopting Blue Mirror, they said increased operational efficiency, reduced downtime, an increase in staff skill, and better understanding of the importance of fit checks and donning and doffing. So just to wrap this up here, we'd like to thank the organisation involved, they know who they are, for being such wonderful customers first and foremost, but really giving such valuable regular feedback. That's such a crucial part of that relationship we have with our customers, and it's been an absolute pleasure working with them, so thank you. So moving on now, alongside the aged care standards, the National Safety and Quality Health Service standards have key information on how and what organisations need to do regarding the prevention and control of infections and staff education. So standard 1.2, Safety and Quality Training, specifies that health service organisations uses its training system to assess competency and training needs of their workforce, provide access to training, and monitor with workforce's participation in the training itself. With Blue Mirror, you can roll out not only a PPE and hand hygiene training program that's available 24/7 on any device you need, you can access dashboards that provide the transparent data you need in order to adequately assess competency within your teams. Standard 3.07 has a focus on the processes for use, training and testing of PPE and assessing the competency of workforce in appropriate use of standard and transmission-based precautions. In addition to this, there's a section which emphasises the need to have processes to improve compliance with standard and transmission-based precautions. Training and competency assessments go hand in hand, and we know that, Having users going through training that's fun and engaging, novel, improves their practical PPE and hand hygiene technique is definitely going to improve their competency. And that for us was evidenced by a study that we ran in the UK, where a bunch of clinical staff had a competency assessment and then trained on Blue Mirror and then had another competency assessment. And we saw a huge improvement in competency for both donning and doffing in that study, and we're more than happy to share those results with anybody who would like to see them. Assessing the competence of appropriate use of standard and transmission-based precautions can be achieved, and we saw that in the video that we played initially, where we can ask a clinical scenario-based question, so then users are setting themselves into a scene. If we have a poster on the wall with a patient that says they're in contact precautions, but then they tell us they've been coughing or vomiting, what enhanced precautions, if any, would you use? And again, they can apply that critical thinking to direct them to also wearing a mask, perhaps. Standard 3.1, hand hygiene. When it comes to hand hygiene, organisations need to have a program that can use the results of audits to improve their compliance. Having a protocol that can assess not only the moments of hand hygiene, but practically assess your hand hygiene technique improves that feedback loop internally, so you're not caught off guard as much. And for users, it's important to have scenario-based questions that put them in that context of care again. So, for example, when we think of the 5 moments, a lot of the clinical staff, myself included, can list the 5 moments very easily, but when you pose a clinical scenario, people often have to stop and pause quite a lot to think about where in that procedure or interaction with a patient do you need to wash your hands, if at all. And that's a really important thing to train people on, because if we don't do that, it doesn't matter if we get the right time, if we're not doing the right technique or applying those right times in real practice. Rounding off with the national standards, health organisations have to have processes for aseptic technique, which identifies procedures that require this aseptic technique, and assess their competency of maintaining it. They also have to provide training that addresses any gaps. And we are so excited to showcase our next training module that will soon be available to the market, Aseptic Technique. This training will provide a range of common clinical procedures, such as wound dressing changes, inserting an IV, inserting a catheter, and specifically train users on maintaining aseptic technique throughout those procedures. This is a great way to address knowledge gaps in your staff and have a tool on hand for your team to practice if they need a refresher. Oftentimes there's a high focus on the clinical skill itself and an assumption that the principles of asepsis are well understood, but we know that that's not always the case. We have had a huge number of inquiries about aseptic technique training, and we really look forward to bringing this to healthcare organisations very, very shortly. Before I go into any more detail about aseptic technique though, I just wanted to present to you the findings of 2 separate evaluations of Blue Mirror undertaken by Maria Jaraja and Joel Collins from the Central Adelaide Local Health Network. So in the first evaluation, they were comparing the quality of training of Blue Mirror with the nurse educator. In this blinded assessment, random people from the group trained by Blue Mirror and random people from the nurse educator were assessed on their donning and doffing, focusing on their step-by-step accuracy and the process accuracy. And the results showed that there was the same success and error rate, which was a big win for us, to reiterate the high standard of training that we deliver in Blue Mirror. In the second evaluation, Blue Mirror was loaded onto computers in a ward and provided staff on that ward 24/7 access to PPE training. They were invited to use Blue Mirror and provide feedback during that time, and of the staff that completed the training, over 75% felt that using Blue Mirror made PPE training more accessible to the ward staff. From this evaluation, the IPC team concluded that AI was a promising alternative to traditional training, improved access for training shift workers, and it had the potential to reduce the number of training required with increased efficiency. So again, those are all fantastic things. And I would like to take another moment just to acknowledge how appreciative we are to Maria, Joel and the wider team at Central Adelaide Local Health Network in taking the time to run these evaluations. It's really important for us to have real experience and get this feedback direct from the customers which we love to share, and Maria and Joel have been fantastic to work with, so thank you so much for the valuable feedback. Okay, now, as promised, we've got a sneak peek of our upcoming Aseptic Technique Training module. So this is due to be released by mid-2025. This training will be focusing on a range of common clinical procedures and how to maintain asepsis throughout. So as you'll see from the video that you're about to watch, scenarios are presented to the end user, including theory and questions, and then cover off the procedure in a very sequential way. As with all functionality in Bloomerang, organisations will be able to customise this to ensure that it's completely tailored to your clinical environment, and we will work with a number of scenarios for aseptic technique training. So if you are able to let us know particular scenarios that are of interest to you, that would be fantastic. Otherwise, we will certainly be asking. I'll play the video now.
Welcome. This training will focus on the application of aseptic technique principles when inserting a cannula. Pay attention to the following scenario. You are preparing to insert a cannula into the patient's arm. Before inserting a cannula into the patient, should you clean the site with an antiseptic? Incorrect. Cleaning the site with an antiseptic such as chlorhexidine or iodine reduces the risk of infection. Now, let's go into the practical training for aseptic technique for intravenous cannula. Please confirm the patient's identity and explain the procedure to them. Show your hands upright when done. Done. Clean the site selected in a circular motion. Dispose of the sharp needle into the sharps container. Document the procedure. You're all set. Thank you.
Okay, so that brings our webinar to an end, and so we'd like to open up the floor to any questions. You can ask a question in the chat box and either send it directly to us or to everyone. Chloe, did you want to start with reading out the first question?
Sure. The first question we have is, do you integrate with LMSs?
Yes, absolutely. Good question. We do integrate with the LMSs, and we can integrate with your LMS in a range of ways. So that's part of the implementation process for us to figure that out. We are built to integrate, so we do everything as easily as possible from our side, and that gets scoped out during the implementation process as well.
Awesome. Can you pick languages based on individual staff logins?
Yes, you can. So you can choose to identify staff in Bloomerang. So the alternative is to have a completely anonymous session where you don't know who's using it. But if you identify staff, you can choose a language for that person. So when you're setting me up as an employee, you might say that my preferred language is Mandarin. So that means when I either scan my QR code or enter my unique identifier, my employee number or something like that, then I automatically will receive the training in my language that's been selected. You can also choose a language at the beginning if it's an anonymous session.
The next question is, Bloom Mirror able to be used for complex PPE?
Yes, we can. Bloom Mirror can be used for all types of PPE, from putting on a mask or gloves all the way through to a full PAPR. The complex PPE for highly consequential infectious diseases or viral hemorrhagic fever type things, that's a different type of project. So that's always customized, obviously. They're highly specific protocols and very different for each organization. But yes, we can do that as well.
Cool. Then I've got, love this. Do you have any pricing available?
Yes, absolutely. So the pricing is dependent on the size of your organisation. A key focus for us is to make Bloom Mirror affordable for all of healthcare, not large healthcare facilities. So it's based on the number of staff you have. If you want to know more about pricing, definitely reach out to us. We'll be touching base with everyone after the webinar anyway, so we can go through that with you specific to your organisation. We've also had another question pop up. What types of customizations are available? That sounds complicated. Usually when we talk customizing software, it is complicated, and most of us have experienced that in some capacity. We are absolutely not like that. So for customizing Bloom Mirror, it's really, really easy. You build your protocols, or we would do most of that work for you. It's a simple drag and drop, enter the order of events that you want to happen, and for each step you can customize. So for hand hygiene, you can specify how long you want that to run for. You can choose the image that displays. You can add a custom message if you like that says welcome to Holly's healthcare facility. So it's really, really easy. And because we do about 80% of the work for you in the implementation process, usually you're only tweaking things once before you're releasing it to your staff. So yeah, it's very straightforward. Any other questions? We did have a question about whether this was focusing on the strengthened aged care standards, this webinar, and yes, absolutely. Obviously, we've picked out different topics because we're not covering off all of the standards. Essentially, the reason that we've put this webinar together is because we've had so many inquiries about the strengthened aged care standards that are coming out this year, and we wanted to address how we can help with those particular parts of those standards. So obviously we're not addressing all of them, but the ones that pertain to IPC and training, we can definitely help with. So that's why that was the focus for today's webinar. No other questions? Okay, I think we'll wrap that up there. So thank you very much everyone for your time. This webinar will be made available on our website within the next couple of days. We really appreciate you being on the call. Thank you. Bye.
Bye, thank you.